Okay. Good morning, everyone. Welcome to Voices of Healthcare Cloud. This is a session brought to you by Shelly and myself, and we focus on Microsoft's cloud solutions in the healthcare and life sciences space. Before we start, a few housekeeping items. We encourage you all to ask questions. The questions are moderated, so you'll have the option to post it via chat, and we'll be sure to field those to our presenters. Once the session is done, the recording will be available on our HLS blog, and you'll have a link out there shortly after the session is concluded. As for how to engage with the Q&A panel, on the top right, you have the option to click on the question mark, which allows you to open up a text box where you can specify your name and ask your question. You also have the option to post as anonymous, but we'd love to capture who the question is coming from. Once that's completed, obviously we'll field it to our presenters, or we'll answer the question during the chat itself. Onward to the presentation. Today we have a packed agenda. We have Tyler, Chauncy, and Pawan who would be presenting about power of the platform and how you can really use Microsoft's uh, collaboration suite in conjunction with the Power Platform. So without further ado, I'm going to turn it over to Tyler to talk about a very cool application that he created for hand hygiene. Tyler, take it away.
Thank you. Hey, everybody. My name is Tyler Durham. I'm a technical specialist based out of Nashville. So today I'm going to be talking about a solution we built. We built it a few years ago, prior to the COVID-19 pandemic, but it still is resonating and with our customers today. So let me share my screen real quick. All right, so I'm going to do a quick demo of the solution. The solution is relatively simple. Basically, while working with some customers, I was talking to them 2 years ago. We were talking about some of their initiatives, some of their business objectives for the year. And what I came to find out was that several of these customers in healthcare had processes that were either paper-based or email-based, that there really wasn't a budget to spend money, and time on a full-blown application. One of the scenarios that we picked up on was with the hand hygiene in either the care centers, the hospitals, the facilities. And this particular customer, they had a scenario where they used the direct observation method for monitoring hand hygiene, where they actually send a person out to the facilities to perform sort of an audit, if you will, while they're on site. And they'll walk around and they'll monitor the caregivers and monitor their hand hygiene practices and so forth. And that person walks around with a paper-based form and a pen, makes their notes. They send that paper-based form back to the home office, and then somebody takes that data from the forms and enters it into what I like to call the mother of all Excel spreadsheets. So this was one of the first target scenarios that we looked at, to how could we help improve on these processes. And what we came up with was a very simple app that is embedded here inside of Microsoft Teams called Hand Hygiene Tracking. And what this application here is built on the Microsoft Power Platform. It is a simple Power app. It is the user experience layer of the Power Platform. And essentially, the idea was that the direct observers could go from facility to facility with their iPad or their iPhone or their Surface device, whichever device that they use, and be able to begin an audit or for a particular facility. So what I've got here is I've got a list of hospitals. One of the cool things about the Power Platform is it does expose several of the native capabilities of the device. For instance, we could have done a location query and only brought back the hospitals where the observer was in the vicinity of. So I'm going to go over here to Northgate Methodist Hospital and click on it to select it, and it brings up a real simple form. We go ahead and pre-populate as many of the fields that we can so that the direct observer can capture the relevant data, make any particular notes. So you can see I've already got the observer's name, the date and time. We'll put floor number 13 just for fun. I can select the discipline. So I could say I was inside the lab, what unit, let's say ICU, what was the activity after patient contact. what method did they use? Soap and water, location, let's just say the nurse's station. And then the ultimate metric that they're trying to really gather is, was it performed or was it not performed? Did they observe the caregiver, doing the proper hand sanitization techniques, or did they not perform it? So I'm going to ding this particular hospital because that's more fun. And we'll just say it was not performed. There was a checkbox. Did we give them any feedback? And then I've got a place for notes, and the notes field is pretty versatile. If you've got a device that supports, handwriting, you could handwrite your notes, but I'm just simply going to type in some notes here. They did not wash long enough. And then I can hit save, and it'll actually save a record to the back end. And then if I want, as the observer, I can restart the entire process again. What we've done inside the context of Microsoft Teams is set up a sort of a command center for the clinical outcomes group here. And so in real time, I can actually come over here to the reporting arm of the Power Platform, which is Power BI. And we've got a real simple, dashboard with some metrics. And you can see here that Big Sky and West End are doing very well with their hand sanitization, and then Northgate and Stargate are doing not as well. In fact, Stargate is at 38.8% of people washing their hands, so it's probably recommended we shut them down. All jokes aside, all this data, is coming in real time. We're actually storing the data inside of SQL Server, but you could take the solution and actually store it in something like, SharePoint or the Common Data Service, or if you use a different database, you could easily take the solution and put it on top of any database layer that you so choose to do so. And what's really good about this is we've actually put the solution up in GitHub. If you go to github.com/smarterhealth and scroll down, you will see hand hygiene tracking. And what we've done is we've kind of put this up there as a starter solution where we've got the database, we've got any of the images you may need, we've got the Power App and the Power BI reports, along with some simple instructions on how to install it. So it's a relatively straightforward solution that you can kind of use if you've never built a Power App before. You can take this solution and install it into your own environment, take a peek at it, kind of get to know the Power Platform. It's a really great platform for these type of business processes where there's not necessarily a dedicated budget or a dedicated development staff that can, take some of these very important business processes that may not have, the highest visibility across the entire organization. And that's all. That's the solution in a nutshell. Are there any questions or anything? Do we have anything coming in from the chat?
Yeah, Tyler, we have a couple of questions around how do we have other customers delivering this? Like, what kind of devices, or how are you seeing this getting into the hands of those observers?
Yeah, so the great thing about Power Apps is it can go on, any modern, tablet or, cell phone or smartphone that's running either Android, iOS, or the Windows platform. So you can deliver it, either in a web browser. You can take a Power App and embed it, in an iframe on a website or as on a SharePoint site. But you can also embed it inside of Teams. Right, so I've got this Power App here inside of Teams. Most of our customers are taking it, particularly for the users that are on the go. Most likely, it would be deployed on a mobile device, which is very simple to do. Once you have the Power Apps application installed on your mobile device, that basically allows you to deploy any Power App built to those devices.
Awesome. So we have one other question here around more of the data, and they're kind of asking about what kind of reporting structure could we have? Is it just for the people that are doing the observation, or can we send that up to like leadership or slice and dice it other ways?
Absolutely. I mean, that's kind of the benefit of the Power Platform, both at the Power Apps layer as well as the data layer, the Power BI. So this report here was built very rapidly, right? And as long as you give access to the data, you can actually take the data that's inside of your database and publish it in what's known as a construct in Power BI as a data set. And people can either reuse your report, and we've got a nice visual and graphic report here, but they can also get at that raw data if they wanted to mash it up with other data sets. Maybe they've got other hospital data that they want to kind of take a peek at, and you can certainly use Power BI to do that. It's very flexible in the way that you can build these reports.
We have another question about what type of effort is required if somebody were to take your code and try to install that in their own tenant. And
yes,
maybe a quick subsidiary to that would be how easy it is to substitute the hand hygiene routine with something else, something logically comparable.
Yeah, so the hand hygiene app itself, there's no code to it. The Power Apps basically provides a no code type experience. You're probably going to want somebody that has more of a passion around these types of somebody that likes to play with technology, somebody that's very interested in playing with technology. But the level of effort really depends on your own internal processes, right? So if you've got an environment where you can take this code, you will have to install the database inside a SQL Server. It's a SQL Server database. You will have to install it in Azure. That's not a huge hurdle for many people. If you don't want to use Azure, you could probably build out the data structure inside of a SharePoint list and then go in and configure Power Apps to read and write that data to the SharePoint list. If you have never done anything like this before, it might take you a little bit of time to ramp up and understand the technology. And we've got lots of great resources and how-tos. YouTube is your friend. Right, you can pretty much go to YouTube and go, how do I inside of Power Apps, and you'll have hundreds of videos that you can use to get up to speed very quickly. But the level of effort really depends on if you take the application as is and just install it. It shouldn't take you more than a couple of hours if this is your first Power App. If you're familiar with Power Apps and comfortable with deploying a SQL database, it shouldn't take more than 20 or 30 minutes.
Thanks, Tyler. I don't think we have any other questions, but we will continue to monitor the chat and perhaps come back to you if there's any. Thank you so much, Tyler. Just wanted to make a quick comment here that for those of you who have a managed account with Microsoft or who has a contract with Microsoft, you can work directly with your account team if you're looking to deploy or you're looking to envision something similar to what Tyler just showed. With that, I'm going to turn it over to Chauncy to showcase something more broader, something more operations oriented. Chauncy, take it away.
Yeah, awesome. So my name is Chauncy Larson. I'm one of our technical specialists here in healthcare out here in the West. I do cover anywhere from payer, provider, life sciences, like my peer Tyler does. I did kind of want to start with just quickly throwing up Microsoft Power Platform. We keep saying this term, but just to make sure everyone's clear, this encompasses our entire low-code, no-code, end-to-end platform, including Power BI, Power Apps, Power Automate, and Power Virtual Agents. Ooh, that's a mouthful, right? But really, the end story of it is having a low-code, no-code platform for your end users, your clinical users, the folks that really are driving the business forward to be able to take care of the business needs at the time that they have them, or to empower your pro devs and your IT to quickly and rapidly get this stuff up. We're talking, like Tyler said, with minimal effort, minimal coding. Instead of having to take weeks to even months to just get a proof of concept, you can have something and build it in person while you're in front of the people as they're kind of telling you your business needs. And that's really kind of the mantra that we have around Power Platform, that lighthouse that we kind of search for when it comes to kind of really developing the story around Power Platform. So that's actually a good segue into my solution that I'm here to talk about today is what we call the Hospital Emergency Response Solution. This came out of a need early on in the kind of COVID COVID-19 crisis, where we had a hospital up in the Pacific Northwest, Swedish actually, and they were in dire kind of needs of modernizing a process. At the time, they were using this Excel workbook that was, by the way, really impressive, right? I mean, the stuff that they did with this thing's Excel workbook was amazing in terms of what they were trying to track around PPE, around bed management, around what's available, and it was really serving a purpose to extend the information that was already in the EMR. But as we all know, Excel has its own limitations. It's a very powerful application, but it's not necessarily meant to be the application to run everything, right? And so they asked Microsoft, hey, is there something you guys can do to help us? And I had the pleasure to partner with this team and to quickly gather all of the Power Platform engineers and a whole bunch of different resources to build out a solution to really kind of replace that Excel workbook, which was prone to have human error. There were multiple copies of it. They had it here in OneDrive or maybe here on a local desktop. So it became a mess, right? And so what we needed to do was replace the interface of going into Excel and kind of working with that, but also aggregate the data in a meaningful way that would allow us to report much more efficiently, but also scale that reporting. And so it was really important that we could not only report on a hospital level, but also on a system level. And then even beyond that, we've now taken that to a regional level, and we're working on national levels with the same tools. So you might have actually heard of some of the reporting that we've brought into here because it all started here. So it was an amazing project. The other thing I wanted to mention is that from ideation to deployment was about, let's call it 11 days. That includes the customer coming to us on a Friday afternoon saying, hey, we desperately need this, us working to quickly kind of come up with some ideas over the next couple of days. But we had a proof of concept, a working proof of concept of all of the different solutions that they needed in front of them by about Monday, Tuesday. So just a few days later, we were able to show them what we could do with our platform and get it up and running. And then about 11 days later, we went into production with it. That's kind of unheard of, and that's really one of the, I think, the powers and the strengths of the Power Platform and what we have as part of our app suite. So what did we do with all of this stuff? Well, we obviously have our Power Apps that we'll be kind of showing today, and we have a multitude of them. So there's going to be an admin app and a front end kind of frontline staff app, but we also have an entire reporting system. And by the way, all of this is available publicly as a free template for you to be able to use in your environment. This blog's available as well. I don't know, Shelly, maybe I'll link it into the chat here shortly, but you can take it here, kind of read up on what we did with Swedish Health Services as part of Providence St. Joseph Health, but also get a link to the technical documentation to help you implement this stuff. Because it's part of the Power Platform and it is a solution that we offer, we also keep it up to date. So as our customers give us feedback on what they need, we do try to help fix that. So that all being said, what am I even talking about as part of this solution? Well, let's start with the front end emergency response app kind of launcher. This app is intended for your frontline workers, for the folks that are kind of walking the floors and saying, hey, here are the things that we need to record, that instead of them having to either write it down on a piece of paper or go into that Excel workbook, we give them a mobile-driven app that they can embed in Teams, that they can get on a computer like we're seeing here, or they can access it from a phone or heck, even a Zebra device, as long as we can install the Power Platform app. So the first page that they get is this ability to choose what system they're in. So maybe they're part of multiple systems. This gives them access based on their identity, access to those different systems that they're a part of, as well as the region, and then the facility that they need to be able to make remarks about. In this case, I'm just going to go with our Atlantic facility called Capitol Beach. And so the first screen that we're presented with is kind of that launcher of sorts. And what's cool about the way that we built this app is if you only need like 2 or 3 of these apps, or maybe a certain person only needs access to 2 or 3 of these apps, you can use security groups and different kind of settings within Common Data Service, which is the backend for all of this, in order to really kind of fine tune the things that your individuals need. And so maybe they only report on 1 or 2 things. You can hide it to where all they see is maybe just bed capacity and equipment, making it easier and faster for them to go and be able to access this stuff. rather than really kind of going through every single one of these apps, because as you can see, there's a whole lot of them, I'm just going to kind of quickly show what some of the interface looks like, just so you can kind of see what we've chosen to do with these apps. So in this case, we're going to open up the bed capacity. And here, what we're thinking about is, again, there's some of this stuff that's actually reported in the EMR already. So our intention's never to replace the EMR. EMR is powerful. They have a lot of important data moving in there. Instead, why don't we take the data that's not being reported? Or maybe let's think about a time when the EMR is not available. How do we start reporting on that stuff to inform and make impactful decisions based on that reporting? So in this case, we wanted to know how many beds are currently in use, the number of them that are in certain areas, what kind of acute care beds are in use, so forth and so on. But also stuff like, are we fully licensed in capacity? I mean, this was at a time when surging was such an important thing, and may or may not, that might become a problem here soon as well. Then we have other apps like the staffing app, and we have an equipment tracking app. Let's go over to the equipment one real quick. So if you can see, if I go back here into the launcher, I can go to the equipment. It's going to actually launch a separate app. When you're on a mobile device, it'll just switch it out, right? And so it becomes kind of that seamless experience that you would kind of expect out of a mobile application. But in this case, again, we're just basically tracking, hey, how many ventilators do we have in use? How many paper hoods do we have in use? And so forth and so on. And again, I can change that based on the location. In this case, the location is a concatenation of floor and location within that floor, as well as the location of that floor in the actual hospital. But you can change a lot of this stuff on the back end, which leads me to the next app in this suite. So far we've kind of discussed what our frontline workers the staff can work with. So again, the intention for these guys is to come in here, record the data, get in, get out, and get on to their jobs. We want to make sure that that's as limited as possible, because we really want them to be focusing on taking care of patients and not worrying about some database and crunching, right? So let's say we need to be able to mass update the data, or maybe we want to change the location data, or maybe we want to see if maybe there was an error somewhere and be able to fix that easily. That's when our backend admin app comes into play. And I'm going to take you into Teams here and kind of discuss. In this case, one of the things that we did is we made it embeddable in Teams so that if I'm a kind of a triager around the stuff that we're trying to achieve, I can easily access this information in the place that I know to access it in Teams, where I can collaborate on the data as well. So here is our admin backend app. It's the admin app for emergency response app. And like I said, you can go and quickly update kind of the region information, the facility information. You can see what's being tracked from a supplies perspective and add new supplies easily. No code. All I'm having to do is hit new, type in the data that I want, and it can start populating into my apps very easily. I have everything from staffing needs. So this is, again, hey, I need this kind of staff in this location, or maybe there's certain people that are being requested. I have basic administration around the configuration of the apps. So instead of having to go recode everything, I can change the name on the fly, or like I said, I can hide and reveal certain apps based on the individuals that are using it. But I also get a kind of a nifty, almost like a histogram of information that's coming out of here. So instead of having to use the dashboards, which I'll talk about in just a bit, we also have access to just some basic kind of reporting that you can kind of see here based on the different location and the different needs coming in per location. So that's the backend admin app that's included as part of this. Well, again, none of this really means anything if we're not doing some reporting on it. And so what we came up with was a series of dashboards in Power BI that aggregates all of this data across your system and lets you make informed decisions. And so you can see there's some cool filters that we built into it in terms of whether or not it's a COVID-based location, again, what's facility that we're wanting to kind of track around. But if you kind of go in here then, and we maximize it so we kind of fully see everything, you can see that any of these areas I can deep dive into. So maybe I want more information around kind of COVID tracking. So I could either track here on the tab on the bottom, or we have also hot links in here, and we can see over time how this different information is being tracked, the different areas in terms of what's positive and what's pending is being impacted by, and we can start making those informed decisions based on live data about how we should be running our different locations, our different floors, and supplying them with different PPE and different staff, and kind of ramping up and ramping down. The intention, again, I've got to hammer this home, we're not here to replace the EMR, but we're here to enhance the information that's going in and out of the EMR, or as a means of maybe if we don't even have an EMR, like we're operating at a church or something, now we at least have this at our fingertips to be able to make those decisions when we need to make them. And so that's kind of a huge, very fast summary of what we call the hospital emergency response solution. Again, like I said, there's a nice nifty blog about it if you want to kind of go read that. I've also got a couple other webcasts where we go into it a little bit more deeper, all of which is going to be linked here at when we're done with the recording. As usual, I flew through that. I talk really fast. So what kind of questions may or may not have popped up in the meantime?
Yeah, Chauncey, we do have a couple here.
Okay.
One is, can you speak to the design process, like thinking about how you wrapped all of these different things together to come up with this scenario that the employees could, easily interact with?
Yeah, that's actually a solid question. So I would argue the majority of the time spent was actually not on building. The building process it took maybe a couple of days worth of work, frankly, especially with the team that we had working on it. It was really the design part, which is we had a group, a small focused core group of clinicians and a CIO at the hospital that they already had this Excel workbook. And so they had a rough idea of what they wanted to work with and the kind of the data that they were inputting. And all they needed to do was translate that from a single page or multi-page workbook into a mobile app, right? And so it really came down to what is important for you guys to track. And they showed us the workbook without any kind of PHI in it, just to see what the interface is like. And then we basically just started building a rough idea of what we had in mind using the Power Apps Maker. And as we talked, we started dropping in fields, we started dropping in rough ideas, and like, yeah, that's perfect. That's exactly what we were thinking about. And as we evolved over the following 3 or 4 days of, oh, well, maybe we want this to be here, or maybe we don't need that information, or maybe, hey, can we add this instead? I would say that's probably the thing that took the longest, is really what all are we trying to encompass? But more importantly, what's the low-hanging fruit that we need to approach right now? Because yeah, this stuff is always going to evolve. We're always going to want to make something more and better, and you can with Power Apps, right? That's something that's cool about low code, is I'm not having to go back and code all this stuff. I can easily just drag and drop a new page into it and start building this out quickly. But instead, it's focusing on, okay, what do I need right now to address what's being asked of me? Which is, I had certain data points that we had to track. I had to be able to make it as clean and simple to get in and fast and accessible as possible. And so with that design in mind, it was basically just a trial and error. Hey, does this look good? No? Okay, let's fix it. And we would do that on hour after hour conversations. Now, of course, not everyone has the ability to go, basically 16 hours a day for 4 days straight. But we did, as we kind of slowed down, it became kind of having a regular kind of touch point, almost like a program manager-esque meeting, to where we just kind of followed some of the agile processes of really going for that kind of sprint and hitting the next sprint and then hitting the next sprint, making sure that we are kind of hitting certain goals on every sprint. And that's really kind of what allowed us to quickly develop and get things out. But again, in general, it was mostly just trial and error based on history, which is that Excel workbook that was already being used. And so we just took the interface, modernized it, and then put it back into it. Did I answer that question?
I think so. Thank you for that. So just a couple others here around, we have one about like, what did you learn from this? And then a similar one about, now that you've gone through this, would you say that there are other scenarios that aren't exactly the same, but maybe similar, that you think you could, pivot to use this app for, but maybe different use cases? So learnings and other use cases.
Yeah, so let's start with the other use cases first. So because of the way that we built this app, we wanted to minimize the amount of potential overhead that an end user would have to achieve, meaning the ability to fully customize this is more around like, hey, does the color fit our theme? Let's change a few words here and there, but it's not really at a core level. Let's fundamentally change the app. That wasn't really the intention of this. We wanted to give you guys a more of kind of almost like an out-of-box solution to be able to work with. I think you might be able to get access to the unlocked code, which in that case you can start kind of building your own thing. But the intention again is more to minimize it. So my thoughts there is, if you do want to kind of evolve this platform, give us that feedback. We'd love to work with you of maybe coming up with a better solution for you. Or B, let's see what it looks like for you to evolve it. And then we can try to get some access to the original code to be able to unlock it and kind of help you guys do what you're trying to achieve. Lessons learned. Oh man, what have I learned over the last 4 months? Well, I learned what it means to work from my desk for a solid long time. No, what I learned is although a huge team came across to help with different aspects, whether it's how does this look, how does it sound, how does it feel, is it accessible, and all that stuff. At its core, there was probably realistically like a pretty small team. I would say about 8 to 10 folks that were focusing on building out the, I think, 10 total kind of functionality, which is the admin app, the multiple frontline workers app, and a dashboard. So the ability to quickly spin this up with a relatively small workforce and then reiterate on that opened my eyes really to the power of Power Platform. I'm a Windows guy, and actually before that, I'm a clothing guy with a music degree. Like, I have zero background in coding. And so the ability for me to see how fast and how easy it is to develop on this platform was mind-blowing. And it really brought on this passion. I'm hoping that it's coming across. Yeah, I kind of talk like this all the time. I'm loud and obnoxious, but really, I love this stuff. I mean, like, Power Apps and Power Platform is awesome. Like, there's so many cool things you can do with it, and I think the sheer amount of stuff that we put together opened my eyes and helped me learn what we could really do to positively impact not only the world, but really healthcare. There are so many processes that we all know exist in healthcare that are paper-based or that are just archaic because of not enough time to fix it. Power Apps enables us to have the ability to quickly fix things on the fly and let our clinicians drive some of those decisions. What do they want? When do they need it? And how quick can we get it to it? Power Platform really kind of checks all those boxes for you. What else?
Thank you so much,
Well,
Chauncy.
Okay, I'll get out of the way.
Love your energy and keep it up, please. Looking forward to more exciting use cases coming from you guys. In the interest of time, do have to turn it over to Pawan to talk about the Building Access app that him and the team have worked on. Pawan, over to you.
Thanks, Vasu. Man, that is a tough act to follow. There's a lot of energy there, Chauncy. Let's see. So I hope you're getting the theme here. And I'm going to go ahead and share my screen as I'm talking, but I hope you understand that we're talking about primarily about these low-code Power Platform. I'm not going to go into the Power Platform pieces. I think Chauncy did a fantastic job. But the key here is that this is a platform that allows you to build applications easily, but not just build them yourself. Take the ones that we built, and I'll talk about the third app here, but take the ones that we built, easily rebrand them, adapt them to your business needs, customize, enhance. These are open source applications. At least the one I'm sharing with you is an open source free application. These are production ready app templates. So take them and make them your own. Let's see. So we are here to talk about Building Access app template. And I'm going to actually start with a couple of slides to set the context. But for those of you who need to drop off early, and we'll put this link in the chat window here as well. But if you were to go to ak.ms Building Access app, all of the information I'm going to share with you is actually here. So you can get to the content, the deployment guides, the getting started stuff, as well as all of the source code. So with that, let me switch over to a couple of slides, just as I said, to set the context. We'll switch back to the browser, switch back to Teams for a quick live demo. All right. So Building Access app. again, we all are familiar with the situation around us. As businesses are looking to open up the offices, you need a safe way to bring in your employees, your workers back into those facilities. Meeting the social distancing norms, meeting the cleanliness, sanitization schedules. Your facilities teams need a way to bring people back into offices safely. Manage who's coming into the building, track who's coming into the building, report who's coming into the building, essentially work around all of the occupancy thresholds they're putting in place. And this solution is, again, a point solution built on Power Platform. Is a suite of 3 apps, and I'll show you all 3 today, time permitting. The key one is the building access end user app, and we'll spend a lot of time in there. That's essentially the app you use to request the access. The building admin companion app. Think of that as the app that your facilities management team, in partnership with your executives, will be using to set up those buildings that are being brought online, right? Basically being ready to bring workers back into offices, managing those occupancy thresholds, managing the eligibility criteria. What is that eligibility criteria? Confirming that the users that are coming back into offices meet those criteria. And again, I'll skip part of this. I think we've talked about these are built on Power Platform, but key here is this is an open source production ready app template. You should be able to deploy that in a less than an hour's time in your own tenant, or if you want to change it, go ahead and quickly change it. Comes with 44 languages out of the box, so it's automatically locale aware, which means if you are in a different region than mine, you bring up the app, it switches to the language of your choice and your environment. With that, let me actually talk about a couple of different scenarios here before we get into the demo. The app is built for a few different personas, and which is where you'll see the 3 different apps that I'm going to share with you. That's how they map. So look at the executives and facilities managers on the left, securities teams on the right, and then the employees and manager kind of in the middle forming a single bucket. As I said earlier, the facilities management teams need to be able to define which buildings are coming online, the occupancy thresholds, what seats are available. Again, they are restructuring layouts, so what your capacity is today or pre-COVID may not be the same. Your key eligibility criteria. These could be health related questions, and we'll take a peek at a couple of demo questions I put together, but these don't have to be health related, and I'll show you a few. Employees making those requests, managers optionally approving them. Again, managers need to be on site too, so they're making that request, and the security teams validating that you have the right approvals in place before you walk into the building. There is a lot more in these slides. We'll be happy to share these with you, but for the in the interest of time, what I want to do is jump back into the demo today. You'll see here, same consistent theme, and I'll keep calling these teams out. The app is embedded within Teams. And one of the reasons we want to do that is obviously it is easily accessible. Hopefully all of you and your teams are using Teams already for chat, collab, or work you do during the day. But if you pin apps like the building access one that I'm sharing on the left navigation, then your users have a one-click way to access those apps, and your teams have a one-click way of deploying those apps. And we'll talk about the other 2 apps as well as to where they are deployed within the Teams environment. So let's look at what the scenario looks like. And actually what I'm going to do is I'm going to go ahead and switch to full screen. This is my view as I open up the app today. Basically looking at my request, it tells me what my next request is. And essentially it tells me, hey, I've reserved a space for today, 7/21 at Market Street office. I have a way to quickly go into that request, and we'll make sense of kind of where this is coming from, how I made the request quickly. But I'm just sharing with you kind of what that end user experience looks like as you use this app. Essentially, it's a way to reserve office space when I want to go into the building, right? And so what I've done is I've reserved the space. I've got some on-site access instructions, and I've got a QR code. Let's talk about how I got here. So this is kind of the end state. This is how my day started, but how did I get here? What I want to do is basically start by saying, hey, I want to be in an office facility hopefully tomorrow, day after, sometime this week, as buildings are opened up. And I have to go through this key eligibility questions. Remember, I talked about the eligibility criteria. The app, the companion admin app lets you configure these questions. These are your questions. What you see here is essentially some demo content that I put together, but these are questions you define, and you can define as many or as little as you want. In this case, let me go ahead and say, again, has anyone been exposed to COVID-19? Okay, let me just say that yes. It actually tells me, hey, you are not eligible to be on site. Again, this is your criteria. I'm just giving you a key scenario. But what we are saying is you define your eligibility criteria. And then based on that eligibility criteria, that criteria is acting as the gate to the request. I have a customer that actually changed these questions to say, are you going to be taking public transport to be in office during this for the reservation you're making? And if you're taking public transport, they deem that high risk, and essentially saying, hey, at this time, we're not allowing people who are taking public transport. Entirely their business criteria. So you can define those questions. I'll show you where those questions can be defined. But let's go through this process again. I'm going to go ahead and say no to all of these and submit. And essentially what it tells me is, hey, now go ahead and select a building where you want to be on site. Remember, these buildings are configured by your admin teams, your facilities teams. Shows me my recent building selections. This is based on the previous request I put in, but I can always search for another building. So in this case, let me go ahead and search for tower, and guess I only have one. I'm going to specify a business reason. So I'll just say, hey, I need to be there for an executive briefing in this case. Again, for your environment, these may be completely different set of reasons. It does tell me I already have a request for July 21. It's defaulting to today. And you saw that when I opened the app. So let me go ahead and pick up, let's say I'm going to be in office on Thursday. It tells me, hey, you got two different areas. And we'll talk about this a little bit before we move on. When you define a building, in your building, you may say, hey, for building A, I'm going to just go ahead and define areas that people can reserve. And so they can be on floor 1, floor 2, floor 3. Or you can go granular. You can say, hey, floor 1, I'm going to define 3 different sitting areas. You can call them open spaces, you can call them zones, you can call them areas. We've had customers building that or configuring that based on their needs. But these can be, hey, in floor 1, I've got 3 seating areas. Each seating area is going to be 20 seats based on the new layouts. And this one might read floor 1, area 1, area 2, area 3, and so on. For this demo, I've just said floor 1 has 50 spaces, floor 2 has 75. Let me go ahead and pick floor 2. Tells me what my request is. I can actually go ahead and pick another one. So why don't we do that and see that scenario as well? It tells me I can go ahead and pick another one. And so now I have 2 requests. Tells me, hey, you can submit the request for 2 days. In this case, let's go ahead and get through this process, and I'll show you some of the other pieces. I'm looking at the time. I think we've got perhaps 12 to 13 minutes left. And so these 2 requests are in. So the system validated, hey, your eligibility criteria looks like you were good. The buildings you picked, the dates you picked, there is no conflict. You're in the system out of the box, you're only allowed 1 reservation per day. So it makes that check, as well as checking to see if the occupancy thresholds were not exceeded. With that, my request, I can see I've got 3 requests now. When I walked into the app, there was 1, and I've added 2 more. Let's go back and see what the other pieces are, and then we'll quickly show you behind the scenes what it looked like. There are some other things you can do. So as organizations are opening up facilities, they may need to provide additional news, information, building schedules, sanitization schedules, on-site worker policies. This is your content. We've given you a place to publish that content. So this is the 2 dummy pieces of content I prepared for the demo, but essentially these will show up as tiles. I can go ahead and click through that, may actually link back to the actual policy documents or sites, but this is one place for you to provide access to your employees to be able to reserve office space, check policies, any news that might be coming in. I can obviously check my requests. We just looked at that. And as a manager, I do have the option of looking at the requests that are coming in. Again, this is defined by your facilities teams. You define if that's going to be auto-approved request or manager approved. And the request that I just put in, if you realize that, it says approved. So that was an auto approve example. But we'll look at this one as well, and I'll show you where that's configured. Where the request comes in, it's not auto approved. Somebody has to manually, in this case, the direct manager, sees that request, is able to see, looks like Megan, who reports to me in this example, has made a request and says that she needs to be on site for a manager one-on-one. Okay, I know that meeting's coming. Or actually, I can go back and say, hey, Megan, that meeting's actually now moved to next week. And so I can actually go ahead and have that conversation. I'll show you how that's done in a minute. All right, so with that, I think we've looked at kind of the overview of the building access app, but let's walk through that scenario. I walked into the building today, and I have this request, and essentially the request is telling me, okay, well, you have this QR code. This is my confirmation. What I'm going to do is I'm actually going to go ahead and connect my smartphone, and with the smartphone, I'll show you, because that's probably the best way for me to show you what that building security experience looks like. As I walk into the building, it tells me this is a monitored building. Anytime you see monitored in this app, what that means is this is restricted access. Somebody has to validate you are who you say you are, and you have the right approvals. And so let's go ahead and blow this up. This is my smartphone. And so this is me playing the role of a security officer or a lobby manager. What I'm going to do is, as I start my day, I'm going to say, okay, I am actually at the Market Street office. And at Market Street office today, I see that there is one approved person to be on site. And that one person is still arriving, meaning yet to arrive. The reason we put this together is we had a request for some of our customers, just like you, saying, hey, for my security teams to plan, for my facilities teams to plan, how many people should we have in the morning when people are coming in, to make sure that there is no crowding in the lobby, people are not standing outside the doors, we get them seamlessly and quickly and safely inside the facilities as we are validating this. So this was a way for us to give them a quick dashboard. This is essentially a dashboard in my app, which I can use to plan my day out with the help of the security teams and the lobby managers. So in this case, what I'm doing is essentially taking a quick peek. You'll see that there is something called validate access key. And as Pawan, me having this access code here, this is a QR code. So I come into the office, I show my QR code. Again, I should be on my smartphone as well. In this case, I'm showing you the example of the QR code on a desktop. But imagine that you had your own smartphone with this QR code open. You walk in, the security teams basically bring up their app, and they're going to go ahead and you'll see me bring up my QR code scanner. So I'm going to go ahead and click on or touch the validate access key on my smartphone. And as I do that, you saw that code I had on my desktop immediately got scanned. So this is the security office view. This is happening real time here. And as I do that, I see that this is Pawan's request. Looks like Pawan's manager is Pawan. In my example, I've set myself as a manager, very intuitive, easy for me to demo. I wish that was the case in real life too. But then it tells me, hey, the request is approved. Shows up in green, big bold. And now I can check you in. So what it's doing is it's letting the security people, folks, letting the lobby managers a way to validate if the person walking into the building has the right approvals. They are who they say they are, given that there is a picture assigned here, and check them in. And then you see the dashboard quickly changing. It tells me that there was one person approved to be on site. One of that person has checked in this case, 1 of 1, and that person is still on site. And again, this tells me, hey, as people leave the building, you should see this count decreasing. Again, this is checked in minus people who left. I can also look at all of the requests for people who are coming in, and you'll see that Megan, that request that I haven't approved yet as a manager, is still showing up. Now, this is a way for emergency approvals. So if Megan walked into the building, and let's just say that I was not available to approve, perhaps I'm on vacation, I'm out sick, Or Megan just made this request and walked into the building without waiting for somebody to approve. The security team has the option of providing emergency requests. So now they bring up this request. It says, hey, there is a request pending approval. Now this link with my name in here, the security team or the lobby management teams actually can click on that name, start a quick one-on-one chat with the manager and say, hey, it looks like Megan is trying to access the facilities today. Is it okay if we let her in? Again, that's optional, but obviously in this case, I can check Megan in, and that action of checking in implicitly approves and checks in Megan, and all of those actions are audited. All right, so with that, let's actually switch over to the third piece, which is, hey, how did we configure all of this? You've seen what the end result looks like. How do managers, how do employees and security team members use this? But let's actually jump over to the last piece, which is the most key one, I guess, as you're setting this up. What I've done here is the Building Admin Companion app. I've pinned it as a tab in the Facilities Management team, assuming this is where the facilities management teams work. What you've done is given them a way to configure all of the information you were seeing in my end user view. And so what I'm going to do is click into buildings, and you'll see these were the two buildings that were showing up. You have the option of configuring additional details. This is where that shows up, monitored versus unmonitored. And I'll show you quickly what that unmonitored view looks like as well, if we have time. But basically what this is, hey, monitored means this is restricted access. Somebody has to validate your access or your approval before you walk in. In this case, you saw me do that with the security team, scanning the QR code and checking you in. If this was set to unmonitored or unrestricted access, what that really means is we are relying on the employees, we're relying on the workers to voluntarily check themselves in and out of the building. So check themselves in as they enter the building, check themselves out. Nobody's checking their access. That's just voluntary access, voluntarily maintaining that tracking system. What I've also done is I've set this up as auto approval threshold. This is the key setting in the environment. Basically what we've done is we've given you, as the teams that are managing your the process, a dial. So if you turn this dial all the way to the left, which is 0 in this case, what we're saying is nothing's auto approved. Everything goes through manager approval. If you turn it all the way to the right, if I set this to 100, it says everything's auto approved. If you set it somewhere in the middle, okay, whatever that setting would be, the first 50% of those requests that are coming in are approved automatically. The rest are manager approved. You define how much of the approvals you want the system to do automatically, and at what point do you want to say, okay, looks like we are getting too close to that threshold that we want to maintain, that occupancy threshold, and I want to manage that. We've also had customers that said, I want every request to be approved. Just go ahead and set that up. And it tells you that everything will be manager approved. So no auto approval means everything. You define the key eligibility criteria. You put in your content in here. You define the on-site access instructions for that building. Again, this is just content. This is text. You're telling the user who's making the request, hey, for this building, these are the type of people who are allowed on the building per your policies. This is the access instruction for this building. You're defining all of the content. As I said earlier, you also define the areas, the spaces. Again, in my example here, I can say floor 1, space 1 has 25 spaces. In my other building that I was on, let me actually bring up this. You'll see that this one's set up a little differently. I have the dial all the way to the right, set up as unmonitored. But let me actually go here. This is where I was making the reservation in our example, and this is just in floor 1 and floor 2. Again, these are your settings. So you may decide, hey, this floor has a capacity of 150. But I only want 75 people, 50% occupancy threshold, and I'm going to set that up. And once I set that up, I'm going to go ahead and set auto approval to 100%. So the building every request will be auto approved, but the occupancy threshold will never exceed 50% because you've set the max limit at 75, all dependent on how you configure this app. All right, so with that, let's actually look at a couple of other things. Key questions. Remember those questions that came up when we made that request? These are defined by you. You define what those questions are, completely configurable. Again, you can define them, set them up as draft, and when you're ready, go ahead and publish new questions. And I know I'm looking at time, got maybe 2 minutes left. This is where you publish all of your news. Remember, I was showing you those news cards. Really easy for you to configure that. Simple word content, you go ahead and copy paste over here. And then the last piece in here is essentially you controlling what the app behavior is going to be like. How many days in future do you want users to make that request? In this case, I've set 14. You could set it to 30, you can set it to 365, you can set it to 5 days. It's entirely up to you, but based on what you define that error message. Those news articles we were sharing, well, maybe you have another place where you're sharing all of those policies. You don't want this in this app, go ahead and turn it off. That's all it takes to customize this. Those key questions, maybe you don't have any key questions. You want people to be able to request that just based on the occupancy thresholds, the seats that are available. Go ahead and turn it off, and those questions will just go away from the flow. And again, if you do decide to keep it and somebody doesn't meet that criteria, this is the message you want displayed. It's entirely up to you to how to configure that. With that, being mindful of time, couple of minutes left, I want to leave some for Q&A as well. Any questions, team, you're seeing in the chat window or the Q&A window?
Pawan, thanks for the demo. Can you speak a little bit about the dev effort required here? You did share the GitHub page, but can you talk about the different components and how much time and configuration is required?
Yeah, so we have, I think, the first 10 plus customers that deployed this app, most of them deployed it under a couple of hours. Now, let me clarify. The deployment piece and all the instructions are very well documented here. The deployment itself takes somewhere between 30 to 45 minutes. And if you want to take some time setting up some buildings for a quick demo, if you're sharing this with the executives on how it would work, you may take another hour or two. But most organizations take roughly a week because it's not just about the tool, it's about the process. Hey, what buildings are we bringing online? How are we restructuring those buildings? What's the layout going to be? How many seats are going to be there? How do we define those areas or zones? What messages do we provide? Are we creating additional policies or news articles or content that need to be shared? It's the process of coming up with all of that that takes a few hours or days. And so we've had most customers that deployed it within a week, but remember that's business processes as opposed to technical deployment.
Thanks, Pawan. We probably have time for one more. Can you decouple the Power Platform piece from Teams if somebody does not have Teams deployed?
Yeah, you can. So in our example, and what I didn't show you was, we have a lot of integrations in this app. The request comes to the manager within Teams. You can actually do a one-click approve or reject or chat with Megan within Teams as well. We have a lot of integrations. Can you decouple them? Yes. Again, this is low-code Power Platform. You can get into the code, essentially take out those actions and replace them with an email or any other action you want. There is definitely a lot of power in bringing Power Platform within Teams and combining them with the chat and collab capabilities. But if your team hasn't rolled out Teams yet, if your organization is still working through it, you can definitely decouple it. There was a question earlier in the chat around Power Apps licenses. I want to clarify this particular one. This app template is completely free, requires no. If you have Office 365 licenses, those licenses are sufficient for running this specific app template.
Thanks, Pawan. We want to be respectful of time, so we'll be closing this session here shortly. But before we go, thank you so much, Tyler, Chauncy, and Pawan for doing these great presentations. We will be posting the recording as well as the resources on the HLS blog, so be on the lookout for that. Thanks, guys, for showing the power of the platform. Looking forward to hearing more from you guys in the future. Thank you.